can you share your screen?
Yeah, sure. Yeah.
Hello everyone. Today we welcome everyone and discuss. So present some topic about the vaccine hesitancy, and then we will talk about the next presentation for the posters, the questions and answers session. Please join me.
One second, I'm just trying to figure out the presentation mode. Give me some time.
In the meantime, I see Sarah. She is one of the new applicants. Sarah to the group. We opened the application process, so I have received a couple of applications for season of the next round. So that's a good thing.
Thank you, Dr. Nader. Thank you, Dr. Abdulrahman, for this opportunity. I'm very happy to be among you. Thank you so much.
Thank you, Sarah. Can everyone see my screen now?
Yes.
Okay. Okay, so today my presentation is about vaccine hesitancy. So as I discussed about it earlier, that recently I awarded a fellowship, which is like I'm trying to develop and implement a counseling approach to achieve the SDG goal, which is like healthy lives and promote well-being for all ages. So at this point, like we know that vaccine hesitancy is playing a big role in order to reach our herd immunity. So my project is about like vaccine awareness approach to underserved community to increase child and adulthood vaccination through a community-based intervention. And those are my project mentors and those. So first I'm going to start like when I started this project. So how did I look at it first, like where I start? So first I collect the data to identify where are the greatest need. So in order to do that, I search some data and try to find out like why some people have like where is the vaccines like demand more and why people are not getting vaccines. Those are the steps. So this is a COVID-19 vaccine dashboard, and any one of you, like this is like about Michigan. So like it's michigan.gov, that data site, and I try to collect that like what are the population group of population are not vaccinated properly, or like how many percentage of those population get vaccinated. So as of like you can see like 4/19/2021, so literally like 3 weeks back, we can see from here that white populations, the black bar is like the initiation of the vaccine, and the green bar is completion of the vaccine. So we can see literally among 34% of the white population got initiated the vaccine, where like 23% of the white population completed COVID vaccine. Whereas if you see African Americans or Black population, the 21% of them initiated the vaccine, means like get the first dose, and 13% of them just completed the second dose. So here you can see the difference, like it's literally double, like 34% versus 21% and 23% versus 13%. So we can definitely see here that African Americans are stay behind from the vaccine. So we need to work on them. Why this vaccine hesitancy? And other population in, as I mentioned, this is only for Michigan data. So it's like Asian populations are a little bit better, I would say, at least like they initiated like it's same comparison as white populations, and others too not bad, but Hispanics are again like way behind. So we can say like mostly African Americans and Hispanic populations are way behind. So from these data, I conclude that I propose my project, and I conclude that definitely there is some hesitancy or like some barriers for those group of population, and we need to work on those. So anybody want to implement or develop this kind of project or try to apply for a grant or something, first you need to identify the greatest need, and this is where you may get the greatest need and which people you are going to target and implement these things. And also this is a data for the like coverage by sex, like female versus male. It seems like females are getting more vaccines than male. I do not have that, like I don't know why. Probably one thing, probably because it's like this age group, I do not have that age group data, but it could be like, but at the same time, male populations are, all we know, getting the infection more and mortality rate also higher, but probably it's because of the reproductive women who are in the hospital or like get pregnant or all that. So probably for some reason they got vaccinated more, but I do not have any evidence to conclude that data. My next slide. Sorry. Okay. Sorry. Okay. So before describing my third slide, does anybody have any idea about what is social vulnerability? You can write anything in the chat box. Anybody like have any idea? This is very important things in order to like, recover or overcome the vaccine hesitancy. So I did not have much idea about that, but when I developed this project, I came to know this is an very important topics that what is like social vulnerability, and I think we need to know that as a practitioner, as a healthcare worker. So basically what it reflects, so it reflects the degree to which societies or socio-economic groups are affected by stresses and hazards, whether brought adult by external forces or intrinsic factors. So basically it is like how it negatively impact the social cohesion of a country. So it can be anything like, like there are some tools to identify this vulnerability index, and based on these tools it is graded. So in a nutshell, like if the social vulnerability is higher for any group of populations or area, that means it seems like the incidence and mortality is higher for those group of population. So this vulnerability tool is uses like same thing I just discussed, it's a census data basically to identify and map places where a community may have more difficulty preventing human suffering and financial loss in a disaster like COVID. And it is like very important to incidents in an equitable way actually. So what are the tools for, like identify this vulnerability? Socioeconomic status, family composition and disability, minority status and language minority, housing types and transportation. So those are the, you can see those are the tool that's basically identifies the index. And we can calculate this index based on these tools. And the more the index is, the vulnerability index is higher, the more the incidence and mortality is. So this is very important things like so if any of you are interested other than Michigan to provide like to implement this data or develop a project like this, so you have to go to CDC or WHO website, or you can Google that specific zip code belong to that area that you are targeting. So then you can have this index number, and then you can calculate like why these mortality and incidence rates are high. So these are all very important. This vulnerability index is very important in order to identify incidence and mortality of a group of population. So as my third slide, you can see that greatest social country in the state with greatest social vulnerability index, like Detroit and Grand Rapids area in regards to Michigan. So these area have a more social vulnerability index, and they have had higher COVID incidence and mortality. And see, this is the like overall SVI index, and you can see like cases per like thousands and then deaths per thousand. It's identified the more the index, more the incidence, and more the mortality. And this is the like top 3 counties in the Michigan that suffers like higher incidence rate and higher mortality rate. And we found that their SVI index is very high too. So this is a very important tool to understand like why these populations are getting like higher incidence and higher mortality rate. Okay, so this is the, so until this, those are the like kind of like data perspective, like how I implement that project, and how I conclude that why we need to address that situation. Now I'm going to describe how we improve these immunization rates. So there is this is kind of a quality improvement project. Like you want to, let's say like a Detroit group of population, or in a clinic, or in a small hospital or a clinical practice, they have low immunization rate. So you just want to increase the immunization rates, and how? So this is considered as a quality improvement project. And I think like all of you are going to join residency this, anytime, all residents are asked for at least one quality improvement project to, like for their residency years. So this is a tool, like same thing, like it is a quality improvement. So any kind of quality improvement project, we use this data, like it's called PATSA. So PATSA, P for plan, D for do, S for study, and A for act. So for this one, first my idea was like plan the test, or like plan the state the question, like what you want to answer and what your prediction is about, and develop a plan to test the changes, like what are the population you are targeting, and what do you want to do, and when do you want to do, and how you want to do. Those are the plan. And then do is like you can, as I said, probably you target a small group of population, small clinic, let's say, and then you just say that you do something like the people, you just calculate like they are either missed vaccination, or they missed their children vaccination, or they did not get COVID vaccination, like let's say 50% of the population. So you just think like, okay, why don't I call them and text them, or like reach out to them for any other way, and then bring them to the clinic to have the vaccine. So then you study, like you analyze the results, and you see like, okay, is that the way it is increasing the vaccination rates or not? Like, reminding them, or calling them, or giving them a message, or emailing them, something like some way of communication or outreach. Is it like increasing the vaccination rate? Let's say you do this for 1 month, and you trying to analyze that, does it helping, or like, is it like going to increase the rate of vaccination? Then if it does, then you act, you keep doing the same thing again and again, and then you will be successful. But if it does not, if you see like, oh, it's not going to help, basically you see like only 1% of the population probably is like, going to answer and come and all that, probably something else it's there, that's why they are not getting the vaccine. So you reach out to them, but some of them are not getting the vaccine because they do not have a vehicle to come to the office and get the vaccine. So probably you have to change your, idea, or you have to change the things that, okay, probably you have to support a vehicle, or provide or arrange a vehicle to bring them in the hospital, or you can do a community vaccination campaign into a school, or, nearby community, in a mosque or in a church or somewhere, and then it has to be accessible to them. So then you go again, you study, and then you act a different way. So in order to do these things, like you have to like continuously repeat like multiple cycles until you reach your goal. So let's say you target 100 population, or it's a small clinic, probably we see like 100 people in a week. So if you want to, your goal is to immunize at least 70 to 80% of the population to develop like herd immunity. So, from your first intervention, let's say like messaging and all that, you say you reach only 10% of the population and you just vaccinate 10%. That is not going to work. Then you change, and then, you reach out to them, you provide them a vehicle, or like, you do some campaign and all that. By that time, you may reach your goal probably is like 50-60%. Then third time, like you do something else. So that is like plan, do, action, and study. So you have to repeat multiple cycles until you reach the goals. So I will do the same things for my project until I reach out to my goals. So my this the slide, like again, it's the data. So because I have to convince them, providing the data, like why my project is so important, and why it is important for those populations. So here you can see this is the data for like literally 5 years, like 16, 17, 18, 19, and 20. I do not have the 21 data because it's not published yet. I think it is going to be published every year in June. So I got this data from Michigan Care Improvement Registry. So you can see this is the data for the 1 month of the children. So it is showing like 16, 17, 18, 19, and 20. You can see 20, basically all age group of the children, the vaccination rate declined. Only population did not decline is the children who is like 1 month old. Why? Anybody has any idea why? I cannot see your chat box, but I'll see later on. So basically, the first month, the children get the hepatitis B vaccine within 3 days of their life. So the hepatitis B first dose, basically they got 24 hours after the birth or 48 hours. So they got after the delivery. So that's why probably it did not decline the 1 month vaccine. But as you can see, all these other like age group of vaccine, like 3 months, 5 months, 7 months, 16 months, 19 months, and 24 months, all of them are declined in compared to like other years, like 16, 17, 18, 19, and 20. So the black bar is basically for the 20, and it's like decline for like all these things. So that means we are missing behind basically Hep B second and third dose, and then mumps, measles, rubella, as well as polio, DPT, those things. So those are all like, if we do not develop like herd immunity, at least if we do not vaccinate like 80 to 90% of the population, so it's like, we are inviting another pandemic. So this is the message that we need to work on COVID vaccine for sure at this point. But if we do not work for measles and polio or diphtheria, we may be inviting another pandemic in a couple of years. So now I'm going to talk about what is vaccine hesitancy. So hesitancy is like, anything that refers to delay in acceptance or like refusal of the vaccine, despite of availability of vaccine service. Means like there are two things. One is availability, one is accessibility. So in United States, let's say the vaccines is available for everyone who is even like, regardless of their immigration status, regardless of their income, regardless of their job status. So it is like it is like available for everyone. So everyone can access it if they want to. I mean to say like everyone who is 16 and above. So here, if anyone refuse, that is called vaccine hesitancy. But in compared to like, other countries, let's say like developing countries like Africa, India, Bangladesh, Asia, and different countries, those people, some of them, they wanted to take the vaccine, but it is not accessible to them. So this is not hesitancy. So there are some difference in accessibility, hesitancy, and affordability. It is very complex, and of course, like specific varying across time, place, and vaccines. That's what I just explained. And it is influenced by various factors such as complacency, convenience, and confidence. So I am going to describe those hesitancy model. So this is the like triangle of the hesitancy model. It is like first thing is complacency, confidence, and convenience. So it's like complacency is like it's a word, but it's like a self-satisfaction, especially like accompanied by like any unaffected of actual danger when it comes to like safety. And convince is how you convince yourself to have this vaccine, right? I mean, very little effort probably you have to do it in order to convince. And and confidence is okay, the society is confidence about like building the trust or something. So this is a three very important triad in vaccine hesitancy model. If you overcome these three triad, you can overcome hesitancy so far. So again, same thing. So confidence is basically trust in the effectiveness and safety of the vaccine tool and the system that delivers vaccines and the motives of those who establish policies on necessary vaccine. So it is very important, the confidence, you have to build the trust and confidence. Convince is the, I'm sorry, convince is the extent to which vaccines are available, affordable, and accessible. And, and complacency is perception that risks of vaccine preventable disease are low and vaccines are not a necessary preventative. So, same thing again, like there are lots of, like rumors around and all that, that how much like like especially about this COVID vaccine, that how we know that it will prevent my COVID, like it will prevent to have COVID uh, disease in future. So like this is complacency. Like some people know that like that perception that risks and it probably may prevent, but they're still not convinced that okay, it may prevent. Their thing is like I may take it, but I don't know, like there is not enough data to suggest that, it may prevent or something. So this is like all hesitancy tool, and we just have to work on this tool in order to overcome the hesitancy. So same thing here, like how do we combat vaccine hesitancy? So there are so many, different things, different way you can do it. But first thing is the spread the awareness and improve vaccine literacy. So like, we know all of, like there are so many, we are living now in a social media, world. So the problem is anything and everything, anyone or everyone can put in the social media and people can believe. There's so much information everywhere. So as a healthcare worker, our duty is to spread awareness and improve the vaccine literacy, like how it works, and like, like if they have any questions or like, from development to like, side effect, benefit, efficacy, everything. So we need to spread this awareness and improve the literacy. Also, like we may think they might know, but how do you know? They might not know what we know. And then building the trust and confidence in the safety and efficacy of the vaccines. So of course, like you have to build the trust and confidence to the people, like, oh, it is safe, and this vaccine is very safe, and also like it is very efficacious, because they might say like, yeah, it is not going to stop, but if all after getting the vaccine you may get COVID, but still it will decrease your hospitality rate, mortality, it will be very less severe than without the vaccine. So like we have to explain those things. Probably some awareness camp, like people have like so many questions about this new some people believe that this mRNA messenger RNA technology is very new, but it is not a new technology. There are some other vaccines also developed previously, which is the same technology, this messenger RNA. And there are so many rumors around like, oh, these vaccines developed only within 9 months, so they did not meet all the regulatory protocols. which is not true, because it's compromises, it did not compromise any regulatory practices. And it is not a new technology, it is a old technology, but this is a new virus and new vaccine. So we are basically inserting a old technology to a new virus and new vaccines. And you have to explain some potential side effect, like there are some side effect for any kind of vaccine, even for flu, or like pneumovax, just like shingle vaccines, any vaccine they may get, or any medical treatment, there is always little bit of side effect like fever, runny nose, and all that. And this is like should go away in 2 to 3 days, or like probably maximum in 1 week. So explain those side effect is also important. And if they have any allergic reaction to anything previously, we should just check before that, before giving the vaccines. And I think Pfizer and Moderna, like they have a very less chance of allergic reaction to vaccine as per their protocol. So it's very minimal chances that they have get any vaccine allergy or any kind of very rare side effect. Still, it is our duty to explain them the potential side effect which they can have from any medical treatments or any kind of other vaccines. And share your own experience with the population will build the trust. Basically, let's say like we are any healthcare provider or nurse practitioner or pharmacist who have the who are authorized to give vaccines to the people, like people trust the medical, like see, you are a primary care physician, so of course, like they trust you more than the other people. So you can say your own experience, hey, I got the vaccine, nothing happened. And I have like even 17 years old boy or girl in my family, and she or he also got the vaccines and she is completely fine. So the people also build trust. Oh, okay, so my physician got it, it's probably he knows and he did it for herself and her family, probably we should get it too. So that's if you share your own experience, sometimes it also build the trust to the other people, especially it's a relationship between physician and patient. If you can build the trust by that way also. Try to find out some barriers such as transportation. So sometimes we just feel the hesitancy is only related to like the belief or mistrust or like some things, but it can be maybe something else. You may call your healthcare, like the nursing home facility, and you ask them like like all the older population to have the vaccine, and probably they are willingly to get it, but they cannot come to the office to get the vaccine because they do not have a transportation, they don't drive. So especially for the isolated population, so you have to make an arrangement, an alternative arrangement for them. So that's how probably these are the points that how we can combat hesitancy. Here is some case scenario I came across. So I put two case scenario. One is like a young adult, which is like 17 years young adult, came in a clinic with his family, and his parents got vaccine. And healthcare worker asked that does he want vaccine today? He refused and stated that he is not going to take vaccines, even though he's if he gets COVID, his body is going to tackle it because he believes his immune system is very strong enough to fight COVID. How you address this situation? So anybody has any idea, like want to talk? In that case, probably I'll pause myself and like hear your opinion about it.
Hello.
Yeah, go ahead.
Some of the things that you can bring to his attention is that COVID doesn't affect only the old people. There are some of the young population, some young people were affected by it, and it's not just for old people. You cannot predict how your body is going to respond to that. And also, if you get the infection and you are asymptomatic, or for example, you can fight the infection, you are going to be a liability. You are going to predispose others to get the infection, or you can spread the disease around and like make the situation generally worse. So it's not only you are protecting yourself, you're protecting others. And also the thing is, like, the vaccine, even if you are still going to be liable to get the COVID, but the chance is that you will have a very mild disease compared to someone who didn't get COVID. So these are just maybe some of the points that you can discuss to
convince him.
Yeah.
Thank you, Marwa. I assume that's Marwa. Sorry, I cannot see. Okay, that's a very good point Marwa mentioned. Anyone else?
Yeah, I would like to just say here, the age of the patient here or the child is very important. So what Marwa said, I believe, is very important, and it's the true answer. But the age varies, because teenagers would probably, when they hear something like, if you do this, you would most probably result in catastrophic effect on your parents and so on, they would be like, you know what, I'll keep doing whatever I'm doing. They're very stubborn by nature. So that's, I believe, something what Marwa mentioned can work for some teenagers, but the majority would prefer some angle like saying, well, you're true, you're correct by what you're saying, but it's important to know that we are trying to protect the whole generation here. We are unfortunately at a very bad situation. Our goal is to try to protect ourselves and everyone in the community. Some form of an angle. I think the way we say it, it can vary, but it's the same answer as Marwa said, but we need just to place the age into our perspective while answering this question. Thank you.
Thank you, Mulham. Mulham really point out a very good point, which I was looking for. Convincing this young age, that's why I put this case scenario, because this is challenging. These 17 years old young adult, I mean, they to tackle their belief and they're facing them, it's very struggle these days, especially see, like, this is a real scenario. I make a scenario, but this is a real scenario when I was working with them actually. So what happened here, when you challenge, when you face this kind of questions and challenge, you always have to remember in your mind that this is a 17 years old. So they have always a very strong willed, and by asking them or by judging them, their knowledge is not going to help you, because raising your finger against someone's thought is not helpful anyways. So what we have to do it, his question is his response is very legitimate, right? He said that, I'm young and my body is going to protect, if or even though if I get COVID. But exactly, we should ask him like, hey, did your any other friends or peers get COVID vaccine? How are they doing? So, if they are doing well, so if there are probably some side effect for sure, but you just cannot assume that I think that is also not a good approach, by saying that you cannot assume. Probably instead of saying that, we may say that you are getting these vaccines, not only protecting yourself, your family, your grandparents, your community. So it is, as a young citizen, it is all of our responsibility to protect the community, and to provide more room to reach the herd immunity. So even like if we do not vaccinate the young population, we will never reach to the herd immunity, and we just have to stay home forever, like this COVID pandemic. So this is like a big picture and then impact on everyone else's life. So how you consider that thing? So this is something like beyond science. Sometimes, like just only believing them about science is not helpful, but when you make make them think about their community, their family, sometimes it that way that may convince, but it's very hard to convince this young population. All right, I think Ali raised his hand. Please go ahead.
Yeah. Can you hear me?
Yes.
Okay. I think this is one of the very difficult situations. I had it. I had my colleagues having the same concern, even though they are health workers. But I think some ways to tackle this problem by pointing out that if you have been fully vaccinated, I think the CDC or NIHS, I don't remember, they have recommended that no need for testing if you are traveling abroad. If you have a small gathering with you all being vaccinated, no need to wear masks and so on. And also, you are going to, if you all get vaccinated within the pandemic, and and we will be, we will come back to our normal life without masks, social distancing, and so on. So I think maybe great point to to address this issue. Thank you.
Thank you, Ali. Yeah, that's a very good point too. That recently, I think CDC recommended that if you are fully vaccinated and the small gathering, you don't need to mask up. So which are they are going for? And like if this is a 17 year, so probably they can go for their graduation without the mask, or like their basketball game or tournament without the mask. So which is also a convincing point. Anyone else? Okay, if not, then I'm going to the second scenario. So second scenario is like a 80-year-old woman came with her son in a local pharmacy to get COVID vaccine. While she was waiting, after the vaccine, like everybody has to like 15 minutes waiting time. So while she was waiting 15 minutes after the vaccination, she asked the pharmacist that my daughter lives with me and she's 45 years old and she works as a scientist in a pharmaceutical company. She does not want to take vaccines at this time point. She believes that there are not much data yet to provide and that these vaccines are effective. And she is worried about the long-term effect of these vaccines. How to address this situation? Okay, again, I'll pause myself, and anyone have any idea how to address that? Okay, so there are two scenarios here. It is 80-year-old woman, right? So that patient was like, that person was 17. So there are two difficult case scenario here. So one is 17 and here is 18. So this 80 years old woman, basically she is expressing her, if you think like, she lives with her daughter, who is like 45 years old. So she is asking the pharmacist, who is like a healthcare worker, so that she is basically concerned that if she get vaccinated and her daughter don't, so if how it gonna affect her. So she's basically worried about herself and her daughter. So we have to link that all, because she probably read some news or papers or whatever the social media that like older persons are like are prone to get more, severe disease than others. So she considers herself, did get this vaccine, but her daughter. So we can address that. Yeah, that's a legitimate question actually, right? Like we do not know, because her daughter is a scientist working in a pharmaceutical company. So, she does not, she is declining because she thought there is not enough data to prove that, what is going to have a long-term effect of this vaccine. But we still can convince, see, you are getting this vaccine today, you can convince her that as 80-year can tolerate this vaccine, it should be okay with her. And also she can consider the vaccine not for herself, she has to protect her mother and her family and her community also. So that is one point. And for the long-term effect, still, yeah, that's true that we do not have much data yet. But at the same time, we can say these vaccines were developed same technology like mRNA, and this is not going to change your own body DNA or anything like that. It is basically a messenger that it will protect and it will form a antibody against that vaccine, but it is not going to change your own body's mRNA or DNA. Of course, probably she might know those things, but we just still can convince that it is if she did not get the vaccine, probably the whole like it is a like risk for her mother too. So you can go home and ask her, like, if you feel okay with this vaccine, and then she should be okay too. And so this is one kind of way to, address this situation. So here are some tips like how to combat this vaccine hesitancy. First, I would suggest listen, try to understand what's their concern, do not assume. So basically, sometimes what happen, like we feel what we know, they know, but it is completely opposite. What we know, they do not know. So we should not assume that what they do not know. We should try to understand what their concern is. Assurance, always assure that it is okay to have questions, and their concerns are legitimate, of course, because this is the new disease, new vaccines again. So we do not face this situation in our lifetime. So it is okay to have those questions, and like it's their concerns are really really legitimate. That's why you are there for, like explain their concern and questions. Conversation. So when we discuss these things, we have to give them a safe space to have this conversation. I think, like, we should not wag our finger against someone's belief. So it will not probably be helpful to convince them. And instead of that, makes them more irritated, and like it will build a mistrust or misunderstanding. Try to understand their doubt. There are like different types of doubts, like while, like, some people believe that vaccine may contain microchips and that may alter DNA and they impair infertility. So like we have to explain that this vaccine does not going to impair your own DNA. It is like just a messenger RNA, and it does not contain any kind of microchips or any those. These vaccines are made out of like dead virus. So it's not going to contain that. So there are like I think there are specifically there are some mistrust among the Latino population, like from a history that there are some other things happen to them for their infertility. So these people, like some of the people, they believe that it's it impaired the fertility. So especially for the reproductive age groups of female and male, they're very concerned about that. So we have to understand their doubts and try to explain that in a evidence-based way. And some people may ask, may I get COVID from or may I get COVID from the none of them vaccines? So some people ask, like, they heard that if they get COVID vaccine, they get COVID, because they thought the vaccines are made from the like the virus itself. So we have to convince them the vaccines made out of not the live, it is not a live vaccines, it is made out of the the kill the vaccines, and then they made out of that. So this piece of information they might not know. We think like we know, but they do not know that. Beyond science, the same things, like we need to talk about something other than science to change their mind and their strong beliefs, like such as like vaccinate your family or community, help us develop and reach our herd immunity. It's not about only science, it's about your, like you're protecting your community, your family, your we are going to like we are going back to our normal life soon. So that might be a convincing point, especially for the younger age population. Safety. So the vaccine has been tested on thousands of diverse population. Some people may like, last weekend, I worked with some Hispanic people, and then they thought they did not, this vaccine was not tested on the, those people. They thought it was only, tested on the, especially mostly on the white population and Asian population. Especially they know that it's Chinese population and mostly on white population. So I had to convince them that the vaccine when they developed, it was like, excuse me, lots of diverse populations, such as like Pfizer's and Moderna. It was like 10,000 Hispanic populations were tested. Johnson and Johnson, it was 45,000 people total enrolled. Out of them, 15% were Hispanic and 13% were Black. So when these vaccines develop, basically they are trying to cover all of them. So, they can ensure their safety and efficacy. but we know this, they might not know this piece of information. Mistrust. So many Black African Americans have a mistrust of the medical system, because of history, because of the racism, but they have encountered from the health professional is a physician from African American. Okay, so what I'm trying to say is here, see, like, if you work in a African American community, so, it's like, let's say you are working in a single like clinic to increase the immunization rate for them, where 90% of the population of African American. So if you try to, say something to them, it might be not acceptable, but I would suggest that you can collaborate with a physician who is from the same ethnicity, and they can consider, for themselves, like, she can talk like, hey, I have the same anger and mistrust and frustration as you do, but still I strongly recommend these vaccines in this critical situation. So, there is some way, like, it is not like, like it's when they hear from their own community, own people, probably it build more trust than others. So if there is a possibility, you can build trust by considering that situation. So I think that's it. If you have any questions. Thank you all.
Thank you, Sumi. This is a really great presentation, and concise and to the point, very helpful. Thank you so much. So for all, we can share the discussion. If you have any point to add, if you have any questions to Sumi, please raise your hand or go ahead.
Luava, yeah.
Yes. Hello, Sumi. That was really an excellent presentation, very informative. I like your approach and you pointing some point that helps how to convince the recipient or population for getting the vaccine, which is very important at this point. Yes, the last slide.
Yeah, sure.
Yeah, the way of the approach. I found all of them, I think, revolve around how to create trust and how to gain the trust from the whoever getting the vaccine. And that reminded me with the article Dr. Nader shared this morning, thank you. And they were talking about the importance of primary care providers in this COVID vaccine. I believe that will maybe cut about 40% of the trust issue because this is a vendor that they use to get their vaccine through. So I feel like encouraging primary care providers or providing the vaccine for the clinics, I think that's going to be the best approach for those difficult and challenging cases that they're not receiving the vaccine. But this is really great, well done, and really acceptance is really deserved. You did a great job. Thank you.
Thank you, Lubaba.
Mm-hmm.
Thank you, Lubaba, for the comments. And, anyone else? So I'd like to share with you also for the first point, listen and try to understand. I think this is a key point to focus on if you want to, not only for this vaccine hesitancy or nowadays a pandemic, but we teach the residents when they take the history, even medical students, the first step is to listen to the chief complaints. And usually you ask what brought you here or something like that. But we teach them also to use body language and use an open-ended question approach and to use certain words to encourage the other person to talk. So one of the technique is to nod your head, say anything that convey the message that you try to understand the concept or the struggle or whatever they want to share with you. In this case, vaccine hesitancy. And then one other technique is to repeat the last word of their sentence or to repeat the sentence for them so that you convince them that you are hearing them. So if they say, I want to do this, or this is why, then you will say, so this is your goal to do this. You can rephrase whatever they said. The other part is to summarize the things. So this is the first point I want to share. The next point, assurance and conversation. I think one Mulham and Marwa mentioned during the discussion now. I think if you convey what's in it for him or her, the point that Sumi was trying to say is very important to get what it makes sense for them. Say if it's a teenager, what makes sense for the teenager? As Sumi mentioned, maybe they want to play in a tournament or competitive sports, or get rid of the mask, or go to cinemas, movies, and something. What is in this thing that they can benefit out? It's like treating your child. If you have a young one, I will give you candy if you do this. So the candy for them is big thing. So maybe something for the person you want to convince is something big for them. And then you try to convert your discussion to make this highlight on their goal. So these are the 2 points I want to share with you. Thank you. Anyone else?
Thank you, Dr. Nadir. That's very informative. Yeah. I think Ali raised his hand. Go ahead, Ali.
Ali, can you hear us?
Yes.
Go ahead.
Can you hear me?
Yes.
Yeah.
Okay. So actually, this is a great presentation. I really enjoyed it. Thank you, Sumi. I have 2 questions. First one, I don't know if you came across it because I have a very unstable connection today. So it's about implementing vaccination in, I don't know, in a prerequisite for, I don't know, travel, job, schools, and so on. I think children are not forced to get vaccinated, but most schools and daycare and so on, they request a vaccination card to be accepted. And also, I think during residency, you have to complete your vaccination. For instance, I think in Saudi Arabia, during Ramadan and people going to prayers and so on, only those vaccinated are allowed to go to the mosque in Mecca. So I think maybe it increases the need for vaccination. Also, the mall, if you are not vaccinated, you can't enter the mall and so on. I know in Western countries it might be difficult to force someone to do anything, but I think there are ways to do that. So this is my first question. The second one, during your project, how can you measure your success? For instance, if vaccination improves by, let's say, 5% or 10%, how can you say 5% is not good and I failed and 10% is good? Thank you.
Okay. Thank you, Ali. If I understand correctly, yeah, that's a very valid question. So my goal is basically increase the vaccination rate. So, I will not define like how many percentage, 5%, 10%, or 15%, because, it is not a, like I would say, like it, it's a 1-year project. So in this 1 year, I cannot reach my, develop that herd immunity 90%. I should not expect that 90% of the population will get vaccinated. But what I do is that's I suggest that PDA is a goal. So my goal is every cycle, let's say like 12 months of period, I will I'll do a like first trimester, second trimester, third trimester, like every 3 months I will just calculate like, is it what I'm doing, is it working or not? That's the whole point of doing that. If it is even 5% increase, that's a chance. Even like 5% is better than 0, and 10% is better than 5. So I will just keep repeating this cycle like in 12 months of period, like each every trimester or quadrimester I will divide, and then I will see like my intervention is going to improve the vaccination rate. If my intervention don't improve by 3 months, then I will consider a defined intervention, something like that. Is that clear?
Yes, it's very clear. Thank you.
Okay. I mean, you have 2 questions, and what are the other one? I think I did not get it.
Yes, it's about, I don't want to say force someone to be vaccinated, but maybe find a way for schools, most every gathering. If you want to go in, you need to be vaccinated. So I don't know what is the status in US and elsewhere.
Oh, okay, I got you. So US, same thing. It's called it's like a vaccination chart and vaccination entry, registry entry. So if any child get vaccination from US, so it's always get registered from the state, from like any office, any places. And before going to school, like when the children entered into a like kindergarten, you have to the school required a vaccination record. So you have to ask your pediatrician, your child pediatrician, to send that record directly to them, so they can track of it. But what happened here, like see, like I showed you like this graph, these peoples are basically mostly in it shows like all the vaccination rates literally for the children declined for 2020, and which definitely because of the pandemic, because parents are very scared to get them vaccinated rather than get COVID. So even I would consider for my child also, I was very hesitant to give her flu vaccine, as like the COVID incidence rate was very high. So I thought, why I have to consider, because she does not get flu very often and no comorbidities. Why I have to get her chances more? So I mean, I'm just telling you my perspective as a parent. So I'm sure like most of the parents thinks the same way, which is why like declining this rate for the children. And see, like those are the children like 5 months, 7 months, like I showed you data until 2 years of age, right? 24 months, from 3 months to 24 months, where most of the vaccines are due, like Hep B, DTAP, and then MMR, polio, those are right. So like when they will apply to go to like 5 years of children, like school entry, probably they find out this missed vaccine, and by that time we may probably not able to catch up those missed vaccines. So it's better now, I think, if you target what my target was, when these children are not going to get the COVID vaccine so far, right? It's only like 60, I think Pfizer now like announced 14 years can have it. It will be decreasing, I think 12, then 10 and whatever. But for these children are not going to get COVID vaccine. So when they come with their parents, or I can check their immunization chart, and then I can counsel the parents that your children also due for this vaccine. So they already developed their COVID vaccine trust, and if I can build that trust, so I can convince them for the children to have this vaccine, so I can convince that, hey, vaccine can prevent also these diseases in addition to COVID. So that is what was my goal. But I will keep you guys posted how it goes. I do not know yet. I'm very premature, just started last month. But thank you for your question.
Thank you so much. Thank you, Ali. And I want to highlight some point also to Ali. In the US, the response to the COVID and vaccine, and it's different from one state to another. And then the policies changes. Like for mosque, initially the response was not to get into gathering. Then there is a limitation of like 10 people or something outside, or 20 outside, or 10 in the house, something like that. So the government has their own, each state, they raise their policies according to what they think is right, the distance, like the 3 feet distance, using the mask in shop areas or shopping areas, and going to the clinic and so forth. So some policies are there, but not like in Saudi Arabia or others, where for a person to show up in a mosque, you have to show that you have been vaccinated against the COVID. I don't think this is happening. They try to use it for travel. Let's say the airline will ask you about your vaccination history or your card that you have been vaccinated. But I think there are some people who are fighting that. They want to be free to choose whatever they want to. So in the US, it's hard to force people to do things because of the amendment of the First Amendment, that they have the right to do whatever. The other point I want to add before Mulham, you can ask or add your points. The graph, it's very informative. If you look at the black lines of the chart, you will see the decrease in numbers in 2020 compared to previous years. But I think one of the things happened in 2020 that was major setback for all families is, as we got the news that the vaccine is spread very fast, everyone wants to stay home. Everyone wants to limit their going out. You go out just for the necessary thing. You want to get your milk, shopping, or something. Beside that, all stores or clinics initially closed, unless it's hospital or ER or some. So people with kids, most likely they stay at home because they don't want to go to the clinic to get vaccinated because of all what's happening. And the clinic themselves, I think they limit their availability. Initially, in the first few months, most of the clinics were closed and they did online like telemedicine visit. And then later they open it, but with limited number of patients. So I think that's also contribute to the why people did not vaccinate their children. But I think this is an area where we can also study, so to improve in the future about how we can manage this, something like that. But that's a good point. So thank you so much. Mulham, go ahead.
Yeah, thank you, Dr. Nader. And thank you, Sumi, for this great presentation. It was really very enjoyable, and it had new perspective into some COVID vaccine terms. For instance, you said the social vulnerability index, and it's based on multiple factors, and those factors directly affect the COVID vaccine, either taking it or not. So that was a very interesting perspective point to know. As well, you mentioned the PDSA model and the importance of it for the QI project. Thank you for mentioning that. And the vaccine hesitancy model. And that's something really important. And it's right now what is needed to be understood very well, because right now we are in this phase. The ones who wanted the vaccine already have taken it. The ones who are hesitant, they are right now in this moment. So it's important to understand that and to understand the 3 C's, as you said it, which is the confidence, complacency, and convenience. And so we need to understand that, and what Dr. Nader explained in detail, which is the importance of listening. We need to learn that because it's important quality to learn. And thank you for providing the scenario at the end, which really made it very enjoyable. And thank you very much.
Thank you, Mulham. It assures that you listen. You're a good listener. I can tell you that.
Thank you.
Anyone else have any questions? Okay, go ahead, Dr. Nali.
No, that's my comment also. If there is any other questions or any other comments, please feel free to ask or raise your hand.
I would like also to comment about something about the reason why, one of the reasons why there's like, people are more hesitant to take vaccination for different diseases such as hepatitis B and the flu vaccine is because the rate of unemployment increased in the past year. So there's also the lack insurance and the healthcare coverage to cover for the cost for their vaccinations. So this can be another contributing reason why the rate of vaccination is decreased during 2020, and it can also explain the reason why there's still some sort of hesitancy to receive the COVID-19 vaccination as well. Because yes, they are free in most areas, but for instance, if we go to the CVS pharmacy, they check our insurance to decide if we will receive it for free to be covered by the insurance we have, or we would pay out of pocket to receive the vaccine. So also there's financial pose and financial like relation to receiving the vaccine and the medical care or not. And thank you so much, Sumi, for the presentation. It was very insightful. Thank you so much.
Thank you. It's a very valid point. Yeah, it's like unemployment rate is higher, especially among like, underserved population as well. And some parents still believe that, like they lost their job, so they lost their insurance, and vaccines are like, they have to pay from their own pocket, which they don't want to. But, like this is our duty to convince and reach out to them that most of the states Department of Health, basically they offers free vaccines in any age, at any age, and any kind of vaccines, because it is basically a free consultation and free vaccines. But you are absolutely right. We have to reach out to them, and when they lost their job, they just blindly believe that, oh, okay, like we have to pay for the vaccine, so they do not want to reach out to the physicians or like any Department of Health, that by believing that they have to pay. But we should reach out to them, that who is like who have the missed vaccines, and and then reassure them that it's free and it can be arranged. So that's a part of my project too, actually. Outreach, vaccine outreach. Thank you, Sarah.
Thank you, Sumi.
Thank you, Sarah, for your comment, and thanks so much for the answer. And again, to understand what's the reason or the hurdle or the problem why they are hesitant, or they don't want to get the vaccine for them or their family members. But as Sumi mentioned, the vaccine, it's free. Some of the pharmacies in the past, like for flu vaccine, they charge the administration fees, $25 or something. But for this COVID vaccine, now the health department will pay the pharmacist this administrative fee. So no one will pay out of pocket. If you have an insurance, then this pharmacist will charge the administration fees to the insurance. If they don't, and then the pharmacy will bill the health department and they will be reimbursed for that, but it's not going to come out of pocket. So that one thing that we need to educate people when we are spreading the word or doing the outreach for some of these people who are hesitant. Mulham, I'm not sure if you have a question or not, but go ahead. Just go ahead.
Sorry, that's from earlier.
That's okay. I thought so, but maybe. All right. That's great presentation. Thank you so much, Sumi. Anyone else wants to add? So for Sarah, just to summarize or to have an idea, Sumi wrote a proposal for a grant, and she was trying to present her approach to the problem. So when we're writing a grant or proposal, we want to identify a problem or what we call a gap. There is a problem there. And then you try to understand. So you do some studies to get some data, as Sumi did. And then you try to come up with a plan to figure out how to solve this problem. So in her approach is education and asking people in clinic also. So she wrote the grant and applied for the grant, and she wrote a proposal and got the grant. Congratulations, Sumi. So what we think about is, if any one of you guys wants to work on writing a similar proposal and applying to other grant offering entities, then we can work on that and we can see the same approach like Sumi or different approach. We can know how to. It will be good for the community that we serve, and it's good for us as proposal writers, and hopefully in the future you know how to. Thank you. So we can switch part to next section. Anyone wants to talk about the question and answer about the poster AGS? Thank you.
Okay, thank you, Dr. Nader. I wanted to thank you for clearing this up for me. And I think I can check for the data for Ohio State. This is where I stay, and we can start from there and follow up with you on that.
That's great. Thank you so much, sir.
Thank you so much, Doctor. Okay, thank you so much, Sumi.
Yeah, thank you, Sarah. Yeah, if you need any help for, like, every state have the departmental data, like, as I shared, is Michigan Department of Health. I collected all the data from there, and it's available for everyone to see. And I think I shared my proposal with my team who was interested for this vaccine hesitancy last week. But I can upload it in the app if that's helpful for anyone. Thank you.
Should be great. Thank you.
Thank you, so thank you, Sarah. So for the next section of the meeting, maybe we can talk a little bit about your preparation of the question answer. If you have any comments, the project managers or the members, please go ahead.
Okay, so I will start first by recalling what we said last week, which is we had different discussions based on what are the most likely questions to be there in the Q&A next week in the conference. So from the discussion we had, probably we said results and outcomes is the first priority. We need to know it in and out. That's the most commonly asked question. Second is the methods or methodology. Third, maybe data analysis. And then by the end, we said we need to have an example of our or similar project or abstract to our project. So that being said, I have prepared some of those stuff. I'll just mention it in a summarized way for everyone to hear. And then we would go towards the next and third and fourth project, hopefully. So the topic or the title is AI or artificial intelligence to stratify the risk factors in older patients with COVID-19. That is the project. Now, first, we'll start with the results and outcome. What we were looking for was a certain section of people or the outcome of measure, which was admission of ICU to ICU for long lengths of stay and death in patients with risk factors of COVID. The factors we were looking for were diabetes, obesity, and chronic kidney disease. And it had different demographics, age, gender, multiple comorbidities, and lab results. So what was the conclusion of the study? So we concluded based on the study that patients aged 60 or above who developed COVID or who were confirmed COVID based on the lab studies, they were found out to be having a greater risk to develop hospital admissions, prolonged stays, and mortality. And that was the aim of the study. And we proposed the use of AI in older patients with COVID-19 infection to stratify the common risk factors. So here's the next phase, which is what is our methods? It's a retrospective cohort study looking towards 439 patients with confirmed lab tests. We look at patients who were admitted to Sparrow Hospital in Michigan State between March 2020 to October 2020. So that's our methodology. And the data analysis were used using Excel to analyze the data. So that's just a quick brief on what are the things they might ask. We need to know our study in and out, at least the results, methods, data analysis, and those points. And maybe prepare an example for the abstract. Yeah, and that's it. Hopefully that's what they would be asking. But if there's any problem, we'll be ready as well. And thank you.
Thank you so much, Morhan. This is great. Excellent. Thanks for sharing. Anyone else from the other projects? So again, to get up to speed, we have submitted 4 abstracts to the American Society for Geriatric or Geriatric Society, AGS. So they will be presenting these posters. In the past, the posters usually you bring them and you stand with them in the meeting hall, and then judge will come and you present that to the judge, and then they will evaluate you. And they will give prize for good, the best poster or presentation. This time of the year, they will present virtually. So they recorded some of the videos. Each poster was recorded for 3 or 5 minutes. And then this will be evaluated also remotely by the judge. And then during the poster session, they might have some additional questions. So as Morhan presented, the way to answer some of the possible questions. Thank you.
Okay, thanks, Dr. Nader, and good luck for everyone.
Thank you. Anyone else wants to share or?
Yeah, I think Murham discussed like it's the same study for my project also, but it's the only difference is like we are going to identify the cardiovascular risk factor to develop a artificial intelligence tool in regards to COVID. And same thing, our outcome, we are trying to see the mortality, ICU admission, and hospitalization rates. And same thing, it's a retrospective cohort. And I have also same thing, 429 patients in our study. And that's the methodology. And I am trying to see that, any other data that supports our data as well. So I found one that conducted by Henry Ford Hospital, that they have similar data like me and like us, like, it's the same group of population, like same demographics of the population, and mortality rate and ICU admission is like close to our results. So probably I'll talk a little bit about that if any question arise. So that's all. It's the same project. We just split it into 2 abstract, basically, me and Mulham. Thank you.
Thank you, Sami. Okay. Anyone else who want to add or share? Got it. Go ahead.
Yes. Sorry, my camera is off. The electricity is out. Regarding the false abstract, I couldn't really identify areas of potential questions, but I am planning to study this week to see what are exactly the rates of false and its trend in the US. So I expect some questions about that. But regarding what we did, it's the same idea. We compared two different groups during the pandemic and before the pandemic to see if there is an association between the pandemic and risk of falls, and also risk of falls with major injuries. So that is my plan for the upcoming week until the Q&A session. And if anyone went through the abstract and found an area of a potential question, you can send it in the group.
Sounds good. Thank you so much, Khalid. Ali?
Yes.
Go ahead.
Well, I think the potential questions may arise that it's about why intra-articular steroids specifically, and we will go through the scientific evidence-based medicine. Why specifically we give the patient intra-articular steroids for osteoarthritis, and also the relation between pain and neuropsychiatric symptoms. Other questions may arise about how do you assess the patient improvement or worsening, the BIMS, PHQ, I guess, and why these assessment scores maybe not others, and also about that. That's all. Actually, before ending, I want to ask about the session itself. Would it be live like Zoom video and so on, or would it be live chat? Because I didn't get any emails from them. I don't know if they are going to contact you, Dr. Nadir and Mulham, or they're going to reach out to us directly.
Actually, that's my question too. I do not know how to probably for my abstract, Mulham is going to get notified, which is good for me. So I don't need to take the responsibility, and the rest of the cases Dr. Nadir is going to get. So yeah, I do not know how to, I was about to ask that same question. Thank you, Khalid, for asking that question.
Thank you, Khalid. Thank you, Ali, and thank you, Sumi. So I will put Mulham on the spot. If you have a minute, Mulham, maybe you can send an email. I know Marwa in the past sent some emails with some questions. So maybe if you respond to the email with the instruction, just to clarify, is it video chat kind of session, or is it just online chatting like a text method? In any case, it's not gonna be a big of a deal for you guys. It's gonna be questions raised for you, and you are trying to answer that question. So my advice will be two things. Some of the question might be an easy, you have an easy answer for that. You just answer the question. And the approach is to, as we said, to say, this is a good question, this is a great one, and thank you for coming to this session. And then you answer your question. If the question is out of the area where you are prepared, and let's say they ask about different things and you are not aware of an answer to that question. So the best thing to say, again, the same, you answer, this is a great question. What we did is so and so, but this question raised the ask about a different area. So I'm gonna go back and refresh or get the answer to you. If you can leave your email or contact information, and we will be happy to give you an answer to your great question, something like that. And this happened also during rounds when you are resident. Most likely you will be at round with your attending. Some of the attending like to ask questions about the patient or about the case or about the topic. So sometimes you have the answer, so you just answer right away when you are in rounds or in grand rounds or during the discussion. And sometimes you may not have the good answer. So it's better to tell them that I don't know. This is a good question, but I will get back to you with the answer, and then you go back and look up the answer, and then next time you have an opportunity, you can answer that question. Does it make sense to you guys? Thank you.
Yeah.
Thank you so much. Any other comments or any other questions? Anything to come in this section of the meeting?
Hello, everyone, and welcome, Sarah, to the team. I have a suggestion that maybe we can start from tomorrow. We will put one of our posters in the WhatsApp group, and then we can review it quickly. And if anyone have any questions, they can post it. And the day after, the second abstract, and by this way, probably you'll have much of the questions, and we can prepare our answers. Thank you.
Great idea, I guess. It's a great idea.
Excellent, I agree. So if someone can add Sarah to the WhatsApp group so that she can participate with you guys, that would be great. Thank you. Well, if there are no more comments or questions, we can go to the next section of the meeting. For the next meeting, I need someone to volunteer to lead the meeting. I have a good news. Tamador got a new baby born, and she was sharing that news. I'm not sure if she shared it with you guys in this WhatsApp group. So we're gonna miss her most likely next week. So if someone wants to volunteer, if you didn't do lead a meeting before, maybe you want to do that. If you did, that's also a good chance to practice more. Thank you. Baba.
Oh, thank you so much. I just want to comment regarding the video chat for the Q&As. Based on AMDA experience, I think you guys will receive an email with the link to the video room that will be active maybe an hour or half an hour ahead of the time. And however, you're going to get another session for rehearsal as well. So to find all of those technical issues and solve them earlier. So I think you will be communicated like 2 days ahead of the program or 1 day with the link. And I saw that Khalid mentioned in the chat link, it's going to be an online. So my expectation is going to be similar to that. So for next week, Ali and I will be presenting grant writing, but if no one is volunteering for the lead, I can lead the meeting. No one else. Thank you.
Thank you so much. Thank you so much, Baba. Yeah, I assume it will be a video chat similar to AMDA, but it's better to be on the safe side. If we get the email, if I get one, I will forward to you. If Mulham or anyone else also gets any additional information, maybe you can share it with the group or the chat. Excellent. So next week, the topics, so if there is any more suggestion, but the topics will be, as Luella mentioned, we're going to start about how we write a grant proposal. Hopefully we'll learn something. Thank you so much for preparing that, Luella, and your effort. And Khalid will be right, you said, or Ali, sir. Thanks, both of you. Any other suggestion for discussion or the week after, if we want to plan ahead? Any other topics?
I think we will get feedback from the Q&A sessions. It's going
Sounds
to be,
good.
yeah.
Sounds good. Sounds good. Excellent. So if you can let me know, or in the discussion, the WhatsApp group, if there is a person who wants to volunteer. Khalid, do you want to add something?
Yes, I wanted to suggest presenting how to write the research manuscript or go over the topic of referencing again. Maybe next week, but if next week's agenda are already set, I can do that the week after.
Sounds good. That's a great thing. If you want to prepare that for the week after, that would be great.
Okay, great.
Sounds good. Let me know if you need any help or if you have questions. Thank you. So any other comments and other questions? So you can use the app to communicate, or you can use email to communicate, or between you can use a WhatsApp. Again, thank you, Sumi. Thank you, everyone, for participating, and thank you for the presentation. Sumi, that's great. Thank you, everyone. If no comments or question, maybe we can see you next week. Inshallah.
Okay.
Happy Eid if we don't see each other before.
True. Happy Eid. Yep. Assalamu alaikum.
Happy Eid, everyone.
Happy Eid, everyone. See you.
Eid
Bye.
Mubarak.
Thank
Take
you.
care,
Thank you
everyone.
all. Eid Mubarak.
Thank you.
Happy to you
Thank
all.
you, and
Thank you.
Eid Mubarak, everybody.